Behavior skills training is used to teach complex skills. It can be used to teach both children and adults, so it's frequently used to train others to implement behavior analytic practices. Behavior skills training is a structured training procedure that utilizes instruction, modeling, rehearsal, and feedback. This training method focuses on skills that can be taught outside of the natural environment, such as job-related skills. BST is ideal for teaching skills that can be taught using role play. The first step in behavior skills training is instruction. The first step is to give the instructions. You're describing the appropriate behavior for the learner. Instructions must be specific, describing exactly the behaviors you want to see the client engage in. Remember, most behavior occurs within a chain. Therefore, the instructions should specify each component in the chain in the correct sequence. Finally, the instruction should specify the appropriate circumstances in which the learner is expected to engage in the behavior. You're describing the entire three-term contingency to your client. There are some factors that influence the effectiveness of instruction, and those include instructions being presented at the proper level, at the level that the learner can understand, delivered by a person who has credibility with the client or with the adult, so someone that's kind of already established some rapport. The instruction is most effective when it's paired with modeling. So demonstrating what you want the client to do. You must make sure that you actually have their attention when you deliver the instruction, especially with adults. You can't go into a teacher's classroom, for example, or work with a therapist who's working with a client because there's way too many things going on. They need to be monitoring what's going on in the environment, and they're going to be a little bit distracted. So you need to make sure that you have their full attention when you initially deliver those instructions. And sometimes it's best if you have the client repeat those instructions so you know that they've understood them in the same way that you've presented them. And after the instruction, give the client, whether it be the child or the adult, the opportunity to rehearse the behavior after it has been instructed. The second step in behavior skills training is modeling. With modeling, the correct behavior is demonstrated, then the client, the child, the adult, imitates the model. For modeling to be effective, the child must have an imitative repertoire. So if you're working with a child in behavior skills training, because remember, this is a great approach for both children and adults. So I'm kind of trying to present it both ways to you. So if you're working with a child, make sure that they have an imitative repertoire so he can actually attend to the model and perform the behavior that's demonstrated. Modeling can be either live or symbolic. In live modeling, another person demonstrates the behavior in the appropriate situation. And in symbolic modeling, the behavior is demonstrated via video, audio, cartoon, or a movie. Like instructions, there are factors that influence the effectiveness of modeling. The model should contact reinforcement. Reinforcement drives us. So when the model exhibits the correct behavior, it should result in reinforcement for the model. So if you are modeling, you should receive reinforcement. This demonstrates the entire contingency chain. The model should be similar to the client or someone they look up to. So think about different elements of the model that the client can kind of pair with. The complexity of the model's behavior needs to be similar to the ability level of the client. If the model's behavior is too complex, then your client won't learn from it. If it's too simple, the client won't pay attention. The client should be prompted to attend to certain aspects of the model's behavior. They have to pay attention to the model to learn from him or her. But more success comes from prompt attention to key aspects of that behavior. So when you say, hey, watch me do this specifically, right? So this is a little bit complex. Pay special attention to what I'm doing here. The client should be prompted to attend, or the model behavior has to occur in the proper context in response to the relevant SD. This means the behavior should be modeled in real situations or in the context of a role play of the real situation. And model the proper behavior several times. The modeling should be repeated as often as necessary for the client to imitate it correctly. To promote generalization, model the behavior in a variety of ways and in a variety of situations. And finally, give the client an opportunity to imitate the behavior as soon as possible after observing that model. Reinforce for correct imitation immediately following the behavior. So this allows them to rehearse. Which brings us to our next step, and that is the rehearsal. Rehearsal is the opportunity for a client to practice the behavior after instruction and modeling. Rehearsal is important because the interventionist can check for skill acquisition. The client is offered the opportunity to contact reinforcement, and the BCBA, the therapist or you, is provided the opportunity to assess and correct errors. During rehearsal, make sure the behavior is rehearsed in the proper context, in the presence of that SD, in either the proper context or role play that simulates a situation. This helps to facilitate that generalization that we really want to see. Make sure you set the client up for success. When practicing that behavior, that skill, start with easy behaviors or easy skills first. Once they're successful, increase the difficulty. We want the client to contact reinforcement so they continue to engage in that behavior. And immediately reinforce all correct responses. Make sure you are providing corrective feedback for partly correct or incorrect responses. And continue rehearsing the behavior until it is demonstrated correct multiple times. The last step in behavior skills training is that feedback step. Feedback involves reinforcement for correct performance and further instruction for improvement. Feedback comes in the form of differential reinforcement of some aspects of the behavior with correction of others. Behavior skills training specifically defines feedback as the delivery of praise for correct performance and further instruction after incorrect performance. The feedback serves as both the consequence for the correct behavior and the SD in the form of a verbal prompt in the next rehearsal. There are some factors that influence the effectiveness of feedback. The feedback must always be immediate. Don't let them go through the entire rehearsal stage without feedback until the very end. So as soon as you see a mistake, correct it immediately with that feedback. And feedback always includes reinforcement for some aspect of that behavior, even if it's just trying. This keeps rehearsal from being aversive. Feedback, especially praise, needs to be descriptive. What exactly did they do right, and describe what they did right. But avoid describing negatively. Provide instructions for doing better. And finally, provide corrective feedback on one aspect at a time and shape that behavior. So pick something that you're really going to focus on and provide feedback for that element of the intervention and shape it until they've reached mastery, and then you can move on to really focusing on another skill. We want the skills learned during behavior skills training to be used in the appropriate circumstances outside of the training sessions. We want them to generalize. This means that training should include a variety of role plays and scenarios that are representative of real life. So incorporate those real life situations into the training. Provide assignments for the client to practice outside of behavior skills training. So give them homework. And then arrange for reinforcement for practice outside of training sessions. So set them up outside of training to contact that reinforcement for engaging in that behavior. Behavior skills training most often occurs in situations different from where the skills need to be used. We might implement behavior skills training in the classroom, but or in a training room, like in the teacher workroom or whatever, but maybe the teacher would be required to engage in the behaviors in the natural environment in the classroom. Therefore, we must train and assess the client in the natural environment where the skills are needed. So with in situ training, the trainer sets up the assessment in the natural setting and then enters the situation if skills are not performed in situ and provides immediate feedback. The client then rehearses the skill multiple times in an assessment situation. BST can also be administered in groups. When you have several children, if you're working with children, or several teacher clients that need to learn similar skills. So group behavior skills training is best in small groups when all of the members of the group have a chance to participate. When you're doing group training, you're providing instructions and modeling to the entire group. And then each group member rehearses the skill in a role play situation and receives feedback from the instructor and other members of the group. Rehearsal continues until each person can perform the skill correctly in a variety of simulated situations. The advantages of that is it's efficient, there's peer learning, and there's really great opportunity for generalization reinforcement, but there's also some divided attention, and you have to make sure that all are participating and getting equal instruction.